Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have peace of mind, real control, real power, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered one of our most frequently asked questions on our blog, and the question was, how long can someone stay in an induced coma? You can check out the answer to that question if you're clicking on the link below this video. In this week's episode of Your Questions Answered, I answer another question from one of our readers, and in this week, Norel from Indianapolis in the United States wants to know whether her 19-year-old son will ever come off the ventilator after he aspirated during a seizure. Norel writes, "Hi Patrick, my son is 19 years old. He aspirated during a seizure. He's been in intensive care for 10 days now, and every time they're going to take him off the ventilator, his saturation drops low. My question is, well, two questions. One, why does the saturation drop low? And two, is he ever going to get off the ventilator?" Before I answer these questions, I just quickly want to clarify a couple of definitions that some of our readers may not be familiar with. Number one, aspiration is the entry of stomach content, mainly food and or fluids, into the lungs after vomiting that often require mechanical ventilation with a breathing tube. And number two, saturation refers to oxygen saturation in the blood that in a healthy person should be above 95% out of 100%. In an intensive care setting, oxygen saturation is one of the main indicators whether ventilation therapy is effective. Oxygen saturation is measured with a finger clip or an ear clip and checks oxygen in the blood. Okay, now coming to the answer of Norel's question. Hi Norel, thank you for your question and thank you for making contact with IntensiveCareHotline.com. I can emphasize with your concerns regarding your 19-year-old son, and I know how stressful, difficult and challenging it is when you see a loved one struggling to come off the ventilator. From what you described and from what I understand from the information you have provided, there is a relatively high chance that your son's aspiration in the lungs causes his saturations to drop. If the aspirates in the lungs have caused an infection in the lungs, which is likely to have occurred after an aspiration, then there may be difficulties and delays in weaning off the ventilator. Also, seizures often need to be managed with drugs that cause drowsiness, and therefore weaning off the ventilator can get delayed. Drugs commonly used in managing and controlling seizures are phenytoin, Keppra, midazolam and or diazepam or Valium. Those drugs or a combination of those drugs can cause drowsiness and therefore can cause a delay in waking up and weaning off the ventilator. Also, know that if your son is having vomits, the breathing tube protects your son's lungs from having more aspirates going into the lungs. The goal, however, should be to get your son off the ventilator as quickly as possible, of course. In some instances, aspirations can cause ARDS or lung failure. However, I would need more information about your son's condition in order to give you more information. But in the meantime, please have a look at some of those articles for you to read and get more information about induced coma, ventilation, etc. in intensive care. You can click on those links to those articles below the video. And for you, our readers, how can you have more peace of mind, control, power and influence whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact report now by entering your email below. In your free Instant Impact report, you learn how to speak the secret intensive care language so that doctors and nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you'll also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How you can eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care. And how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered, and I'll see you again in another update next week. Make sure you also check out our blog section for more tips and strategies, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update. Thank you.